We have a warning for parents tonight about popular acid-blocking drugs. A new study finds that they can increase the risk of an extremely serious intestinal infection.
CBS 2's Dr. Max Gomez says the drugs are even available over the counter.
I just started to feel really sick. Bad stomach aches, nauseous, tired, going to the bathroom a lot.
The C. diff Samantha Konigsberg had is a bacterium, full name Clostridium difficile, that is fairly common in the environment, but under the right circumstances.
C. diff is an infection of the colon, which can lead to very severe inflammation of the colon, sometimes needing removal of the colon, hospitalization, even in serious cases, death.
But since the late 90s, the incidence of C. diff in children, once relatively rare, has gone up tenfold. Now a study by Dr. Friedberg and colleagues at Columbia Medical Center in the journal Clinical Infectious Diseases has found that one reason may be the increased use of acid-blocking drugs in children.
We believe that acid suppression medications may act like weak versions of antibiotics to change some of the bacteria, kill some of the good bacteria, and let some of the bad ones grow.
The acid-suppressing drugs that most increase C. diff risk are called PPIs, which include Nexium, Prevacid, Prilosec, Protonix, and Acifex. There is also a less pronounced risk with the so-called H2 blockers, such as Pepcid, Axid, Zantac, and Tagamet. They're prescribed or bought over the counter for serious stomach problems in kids, but sometimes they're taken for less serious problems like colic.
If there's complaints of irritability, particularly associated with feeding, some increased spit up, a lot of the parents are worried that there's something else going on.
Samantha takes acid blockers to protect her stomach from drugs she takes for juvenile arthritis. Although C. diff can be hard to cure, powerful antibiotics did the trick.
Yeah, good as new.
Now, so far Samantha's been lucky because C. diff often comes back, and then antibiotics that cure C. diff can be almost as bad as the infection itself. Because some of these acid blockers are over the counter, doctors warn parents only to give them to their kids under a doctor's supervision. Again, they're not bad drugs, they just have to be used appropriately.
You bet.
Monitored. Thank you, Dr. Max.